Good morning, GDM members. This is Dr. Kim, Director of Pathology Department in GC Labs. It's a great opportunity to stand here today and share the algorithm for pathologic diagnosis of gastric tumors, which was developed with a partner company called Buno. The left picture shows a pathologist using a microscope to make a diagnosis in the 1890s. The right one is a tree from which hematoxin is extracted from, growing in the Caribbean area. Now or in the past, the most fundamental and important method in surgical pathology is the H&E stains for microscopic examination of tissue. Pathologists feel the changes have been slow in the field of surgical pathology, but there have been a significant advance in the molecular pathology. I'm going to tell you about the digital pathology workflow. With a biopsy specimen, we perform gross examination, then cutting and staining is performed. Next, we digitize the pathology slide with a slide scanner. Pathologists then make a diagnosis while examining the digitized slide in the monitor. As the slide is digitized, it changes to accessible data, so research is easier. The number of AI research papers in the field of medicine has increased rapidly since 2010, especially in the field of radiology and pathology. Pathology research using deep learning is roughly divided into morphology research and the others. Morphology research is then divided into tumor detection, subtyping, and grading, and the others include survival prediction, mutation prediction, and anti-cancer drug response prediction. The FDA-approved product in pathology is an algorithm for prostate cancer detection. Research about mutation prediction and anti-cancer drug response is important and valuable. However, it will take a long time to apply it to a real clinical situation because clinical trials are difficult to perform. We developed a diagnostic algorithm for gastric biopsy, and a paper about it was published last year in Clinical Cancer Research. We did a prospective validation in over 7,000 cases and an observer performance study with 6 pathologists. Gastric cancer is the third most common cause of cancer-related deaths, with 1 million new cases and 780,000 related deaths per year. The gastric cancer incidence rate is high in East Asia, East Europe, and Latin America, where gastric cancer research using deep learning is also prevalent. As you can see, there are various gastric diseases that originate in the stomach. Developing an algorithm for all diseases is practically difficult. So we have developed an algorithm for carcinoma, which is the most important for the stomach disease, and adenoma, which can be a precancerous region. We have developed an algorithm using a revised Vienna classification. The Vienna classification has 5 categories, but during the development of the algorithm, we reclassified these into 3 categories. Category 1 is chronic gastritis or negative for neoplasia. This category is one class in the algorithm. Category 2 is indefinite for neoplasia. We have excluded this category because it's not a biological term. Category 3 and Category 4 are low-grade adenoma and high-grade adenoma, respectively. We have collapsed them into one class, which is tubular adenoma. Finally, we have introduced a new category, carcinoma, with the conventional category 4.3 and category 5 collapsed. The next is the algorithm development process. We transformed the slides of Korea University, Guru Hospital, and Green Cross Laboratories into digital images with an Aperio Versa scanner and sent the images as data to Vuno, a startup company specializing in AI. Vuno developed a diagnostic algorithm using deep learning and enhanced it several times by improving data quality. The next is how to annotate the lesions in a pathology slide. The picture is of a gastric cancer surgical specimen slide with the cancerous lesion in the top right. The area with a high density of cancer cells is annotated in red. In the left side is normal gastric mucosa, and the area with no tumor is annotated in green. The second picture is a tubular adenoma after endoscopic submucosal dissection. The tubular adenoma area in the left side is annotated in blue, and the area with no tumor is annotated in green. We provided Vuno with these pictures. Vuno developed the algorithm using deep learning based on the data. The algorithm transforms the slide images on the left side into the heat map on the right side. We calculate the probability of cancer using random forest based on the heat map. The heat map indicates 100% cancer. Now let's go into more detail about the heat map. The images on the upper left side are normal or negative. The algorithm transforms them all into green. The images at the center area are tubular adenoma. The adenoma area is transformed into blue. The images at the bottom are cancer. The carcinoma area is red. The data used in the research are divided into three sets. The training set, which was used for the development of the algorithm. The validation set for the retrospective analysis of the algorithm, and the test set for the prospective evaluation of the algorithm. About 1,700 slides was used for the development. Of them, 460 slides were of adenoma or carcinoma cases. 756 cases were used for the retrospective study, and 7,459 cases for the prospective study. This table displays the validation set and the test set. The red boxes are false negative cases. There were 3 cases in the validation set. There were 5 cases in the test set. 5 cases occurred due to a lack of training. I'm going to explain to you part by part in the next slide. In the retrospective study, the pathologist diagnosed 328 cases as adenoma or carcinoma. Of the 328 cases, 325 cases were diagnosed as adenoma or carcinoma by algorithm, as well while 3 cases were not. So the sensitivity was 99% and the specificity was 98%. In the prospective study, the pathologist diagnosed 145 cases as adenoma or carcinoma, all of which were detected by the algorithm as well. So the sensitivity was 100% and the specificity was 97.5%. Let's take a look at the heat map. The picture on the left side is negative, and the algorithm transforms it all into green. In this case, the algorithm decides that it's 100% negative. The next is a tubular adenoma case, and the algorithm transforms the adenoma area into green. The interpretation of algorithm is 100% adenoma. The next is another adenoma case. There are two adenoma areas which are well detected by the algorithm. The next is adenocarcinoma case. There are two carcinoma areas which are accurately detected by the algorithm. The next is very small signaling cell carcinoma case. The algorithm detects the carcinoma well. The next is a false positive case where the squeezing artifact was introduced by the biopsy. The morphological change of the glands by the artifact is erroneously diagnosed as cancer by the algorithm. The next is another false positive case. The granulation tissue due to an ulcer is overdiagnosed as cancer. The next is a cancer case underdetected by the algorithm, so it's a false negative case. Cancer cells are sparsely observed by high magnification, but they are not detected by the algorithm. Then, an observer study was performed with 6 pathologists. For the observer study, we prepared 3 sets made up of 50 slides. Each pathologist diagnosed the 3 sets with a microscope, a digital viewer, and an algorithm-assisted digital viewer, and measured the time spent of diagnosis. The result of algorithm is shown as the thumbnail image in the top right. In the case shown here, there are 2 cancerous areas observed. Now let's compare the review time. It took about 50 seconds to diagnose with the microscope or the digital viewer. It took about 25 seconds with the algorithm-assisted digital viewer, a 50% reduction. The diagnosis with the algorithm-assisted digital viewer showed the highest accuracy, but the difference was not statistically significant, presumably because of the small number of cases. This concludes the report on my research for today. As you all know, the recent development of AI algorithms is making a significant change in the field of pathology. In the near future, growing numbers of pathologists will be expected to use AI algorithms when making their diagnosis. Thank you for listening. If you have any question, please send me an email with your detailed question, and I will respond as quickly as possible. Thank you.